A staggering 21% of Americans are dealing with mental health disorders in this country. It's why some communities and healthcare groups are looking to psychiatric nurses to help fill the gaps.
Do you want to use the 3 ml syringe? Because you'll pull up 1 ml, right, for the heparin?
Most nurses will tell you they are drawn into their profession as a calling.
Good.
One that comes with years of hard work, training, and schooling.
Yeah.
But as the country has emerged from the pandemic, there is a growing need for a certain kind of nurse, one that deals specifically with the mental health crisis our nation is facing. They are psychiatric nurse practitioners, and they're in short supply.
It's a very dire situation.
For the last 6 years, Carmen Patillo has served as the dean of Yale School of Nursing. They've seen an increased need for mental health nurses.
We're seeing greater use of psych mental health nurse practitioners.
Psychiatric nurses provide mental health care to patients, often filling the gaps when someone can't find a psychiatrist or a psychologist. Psychiatric nurses can diagnose and even treat things like anxiety, depression, or eating disorders. There are an estimated 37,000 psychiatric nurses in the U.S. Barely enough, say those who see the needs these nurses are addressing.
When we experience a mental health crisis or somebody that we know does, when you start looking for help, that's when it really hits home.
Chizimuzo Okoli serves as the president of the Psychiatric Nurses Association. He says to attract more psychiatric nurses to the field, states need to consider expanding loan forgiveness programs. Colorado recently announced they would be offering $14,000 sign-on bonuses for mental health nurses at state hospitals.
So this becomes an important opportunity with nurses being the largest workforce to be able to step in and meet some of these needs and shortages.
These impacts are often disproportionate depending on where someone lives. 157 million Americans live in areas where there is a shortage of mental health care professionals. A staggering 80% of rural counties have no practicing psychiatrists.
I feel for those individuals that live in rural areas where there is what we call mental health or health deserts. I mean, you have no one, and you have to drive miles, sometimes an hour to 2 hours to see a provider.
Back at Yale, they have expanded their psychiatric nurse training to include an online degree program, targeting nurses already working in smaller rural communities nationwide and giving them a Yale degree without having to travel.
That we were going to figure out a way that we could provide the same quality program that we offer on the ground into wherever that student is working.
Maybe we were listening for respiratory.
The hope is to get more psychiatric nurses trained and deployed to communities nationwide at a time when they are desperately needed. Chris Conti, Scripps News.